bring in physician at Stanford Children's Health, Dr. Alok Patel, for a little bit more. Dr. Patel, thanks for being here. What could a positive COVID diagnosis mean for a fully vaccinated 95-year-old at this point in the pandemic, or what does it often mean?
Now, Diane, a positive test is going to just tell us that there's SARS-CoV-2 in somebody's nose. Positive COVID-19 means that there's some symptomatic illness. Now, the important thing that we have to understand is that according to public reports, Queen Elizabeth does have a vaccination in the past. We don't have the confirmation that she's fully boosted, but this population is still at increased risk, although less so than previously when they weren't vaccinated. So that is good news. And it's also great news that we presumably can say that she has access to great medical care, and that absolutely matters. But if you look at CDC data, for COVID-associated hospitalizations, the largest age group that we're still seeing being hospitalized are those people above the age of 65, at least in the United States. So it still is prudent that we pay a lot of attention to this highly vulnerable population.
And so far we are hearing that her symptoms are mild, but what would you expect the Queen's doctors are monitoring and looking out for right now?
You know, I don't want to offer speculation about specifically Queen Elizabeth's case, because if we were to generally look at any patient out there, we want to look at age, vaccination status, underlying medical conditions, which could absolutely kind of determine somebody's risk factor. So this is what I presume the doctors in England are looking at, as would be the case with any patient. Now, again, I mentioned that we don't know anything about her specific medical history, but I would also suspect that in any patient, we can look at certain medications for non-hospitalized COVID patients that may help, such as things like Paxlovid, which is an antiviral, or sotrovimab, which is the monoclonal antibody, which both show an effect against Omicron. So I suspect this is part of the arsenal and the history and kind of the tools that they're looking at to take the best care of Queen Elizabeth, who looks like she still has great energy, by the way, according to those clips.
Yeah, she's still working, still carrying on her royal duties from the palace, or from the castle, I should say. And also in other COVID news, what about this new Omicron subvariant? Could that affect the lower case and hospitalization numbers that we've been seeing in the U.S.?
You know, Diane, with this subvariant, the real-world data is kind of confusing, because right now, this is Omicron BA2. Only about 4% of cases in the United States are actually being sequenced as BA2. And across the world, we've seen several countries where it's gained a stronghold. And in some countries, such as the UK and South Africa, where the subvariant is actually becoming a dominant strain, hospitalizations and cases are going down, but this is the opposite in places like Denmark. So it doesn't make a lot of sense. Now, the study that's causing alarm bells is this lab study out of Japan. It's important to state that this is preprint, meaning it's not yet peer reviewed. But in a lab setting with animal models using hamsters and mice, they did found that, hey, it's possible that it could cause more severe disease, could be highly contagious, and may even be able to escape some of the antibodies and treatments we have, such as sotrovimab, which we just talked about. So I think the important thing here is that we maintain the surveillance. We're looking out for new variants, and people realize that even when we transition to an endemic phase, everything could completely change, such as this fall, which is why we still can't say like, hey, we're out of coronavirus altogether.
Now, the Wall Street Journal is reporting that U.S. regulators are looking at a potential authorization for a 4th dose of a COVID vaccine in the fall. So what else do we know about that, and why the fall as opposed to the spring, which would be 6 months after some people got their last booster shot?
Well, I think the big 3 questions we have to ask right now, at least domestically, is regarding a 4th shot, who would actually get this shot? What type of shot would it be? Would it be general? Would it be an Omicron specific one? And when would people get it, which is what you were alluding to? Now, right now, we've seen that Israel, Sweden, some other countries are already moving forward with plans for the 4th shot. But as of right now, it looks like cases are going down, hospitalizations are going down, and the original 3-dose recommendation, or 2 if you got J&J, is still providing excellent coverage against severe hospitalizations and deaths. But Diane, I think what you were mentioning was that studies showing that after about 2 months, the protection does wane. But you have to take that into account with the data we have right now. It's what's happening, which is why in fall, things may change. That may be a different time period, especially as we get back into a colder season. And we'll have even more data by then, which is why I think it's a more prudent time for us to say, let's collect more data. Let's see if this can be bashed with the flu shot. And let's see what actually happens with real world data with the booster, when we're not just looking at antibody levels, but we're looking at the complete picture.
Is there any concern about being over-vaccinated? Is that a thing? Could that be a thing down the line? Is there any way this backfires?
You know, I think anything could backfire if we're going against public guidelines, because we won't have a great way to kind of follow that data. And I will tell you, Between you and I and the millions of people who might be watching right now, I know several people who have gone against recommendations and gotten multiple vaccines by going to several pharmacies, people out there who have a heightened concern. And I would recommend against that, unless you are directly talking to a healthcare provider. And if you're immunocompromised and you have increased concerns, talk to someone. Don't just go out there and get multiple shots by gaming the different pharmaceutical systems. That is not the way we want to do things.
All right, great advice. Dr. Alok Patel, always great to talk to you. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.